At Deloitte, we believe that equitable access to quality healthcare is not just a moral obligation, it's the cornerstone of a thriving, economically vibrant society. A resilient healthcare system that's accessible to all, paired with affordable health insurance, drives better health outcomes and eases financial stress during sickness or injury. Yet, in many African countries, equitable access remains a distant dream. Physical barriers and affordability issues persist, making it critical to use resources more efficiently and to develop innovative delivery models. Equity is not just about equal access, it's about ensuring everyone has the tailored support they need to achieve the best health outcomes. It's about fairness, justice, and leveling the playing field. We at Deloitte see emerging technologies as game changers for Africa's healthcare systems, helping nations achieve their healthcare goals. Our Global Healthcare Outlook, released earlier this year, highlights the healthcare systems around the world are under immense pressure. We would like to provide an African perspective on the key trends and propose solutions to tackle major challenges head-on.
Africa's shifting disease burden and rising life expectancies will challenge healthcare affordability. While less prevalent than globally, non-communicable diseases like diabetes, cardiovascular, and cancer are increasing in Africa, driving up healthcare costs, straining systems, and harming economies due to lost productivity and premature deaths. Sub-Saharan Africa has the world's lowest number of physicians and nurses per 1,000 people. Key factors include insufficient funding for training or hiring and the immigration of professionals to regions offering better pay and working conditions. Socioeconomic and environmental factors such as poverty, pollution, inadequate nutrition, poor sanitation, and limited healthcare access further exacerbate healthcare challenges. Urgent, comprehensive action is essential to safeguard Africa's healthcare systems further, including new approaches such as innovative funding models, enhanced training programs, and strategic partnerships to address these systemic issues.
Compared to other regions, Sub-Saharan Africa spends very little on healthcare. The annual healthcare expenditure is less than $75, or just over 6% of the average global per capita health expenditure. Only roughly 1 in 6 people in Sub-Saharan Africa are covered by some form of medical aid scheme. Most Africans heavily rely on out-of-pocket expenditure for their healthcare needs. Given high poverty levels and often irregular income, healthcare emergencies can push vulnerable people into deeper poverty, perpetuating the vicious cycle.
Poor health can force patients to make catastrophic funding choices due to opportunity costs such as travel or loss of income. It is therefore important to ensure patients seek and access medical care at the appropriate level, and that available resources are used effectively. One of the ways we can treat patients more effectively is through role expansion for nurses or other allied healthcare workers, more widely available. The development and rollout of alternative delivery models, such as nurse-owned clinics, has also shown to be an effective way to increase access in previously underserviced communities. We believe that technology will play an important role in improving health outcomes in Africa, enhancing a variety of services while removing the geographic constraints we often face in Africa. Although use cases exist, the real value would be realized through cross-sectoral collaboration, and would only start with building accessible, interoperable data platforms with electronic medical records. While these direct interventions in healthcare system are important, we believe that ultimately political solutions are needed to achieve the best possible outcomes. After all, addressing healthcare challenges is not only a medical exercise, but a holistic societal and political responsibility across regional, African, and global borders.
To find out more on this, read the latest version of our Africa Healthcare Outlook report.